Let me ask a simple question. What is the most difficult thing to reach when you are in a hospital bed? Maybe your phone, your water bottle, or a tissue, or perhaps nothing at all. Because sometimes the problem isn't that something is far away, it's that you are not in a right position to reach it. Imagine waking up at 2 a.m. after surgery. You're tired, you are in pain, and you don't want to move too much. You look beside you. Your water bottle is there. You can see it, but it's just a little too far. You stretch, you twist, and you reach it, but the water bottle falls. And now you need to call a nurse, not for a medical attention, but you need someone to pick it up for you, the water bottle. And this may sound like a small problem, but in hospitals, small problems happen 100 times a day. My name is Jivashree Sasivanam, and today I want to introduce CareDoc, a simple bedside innovation designed around one powerful idea. The things patients need most should always be within reach. When we began this project, we thought we were solving a storage problem. But through design thinking and empty research, we discovered something much bigger. We weren't simply designing a place to put things. We were designing for independence, safety, and dignity. Think about the different people affected. For the patient, reaching for an object can mean twisting an injured body, disturbing an IV line, or even risking a fall. For the nurse, a call button doesn't always mean an emergency. Sometimes it means, can you pause my phone? Can you pick up my remote? Can I have some water? Each request may take only 1 minute, but hundreds of small interruptions add up. For hospital staff, clutter around the bed make cleaning and emergency access more difficult. For sanitation workers, objects on the floor or bulky carts become physical obstacles. So we reframe the problem. How we might help patients independently access their essential belongings without adding clutters, obstructing healthcare workers, or making the bedside harder to clean. The question becomes the foundation of CareDoc. But solving this wasn't as simple as adding another storage box, because if we add more storage, we create another problem. More storage means more convenience, but more storage also can mean more space, more weight, more clutter, and more cleaning difficulty. This is what we identify as our key engineering contradiction. We wanted to increase patient convenience without increasing bedside obstruction. Instead of choosing a compromise, we use TRIS, the theory of inventive problem solving, and 5 TRIS principles help shape our design. The first one is segmentation. Instead of creating one large compartment, we divided the organizer into smaller purpose-built sections. Every item gets its own place. The second one is taking out. Anything that didn't need to stay permanently attached could be removed. This makes cleaning, maintenance, and customization easier. And then the third one is local quality. Different objects need different solutions. A phone needs a quick access slot, a bottle needs a stability, and a tissue needs to be pulled out with one hand. So instead of making every pocket identical, we designed each section for its specific purpose. Fourth one is another dimension. This was one of our biggest breakthroughs. Instead of using more horizontal space, we went vertical. We transformed unused space beside the bed rail into 2-level storage system, and finally intermediary. Rather than requiring permanent installation, we introduced adjustable strap to allow CareDoc to attach different bed rails, headbeds, and even wheelchairs. 5 principles, 1 goal: more accessibility without more clutter. This is where the idea becomes real. This is CareDoc, a compact 2-level bedside organizer designed specifically around the patient's reach. The upper level provides larger spaces for flatter items such as tablets, magazines, books, and the lower level is where accessibility becomes the priority. There are dedicated spaces for a smartphone, a TV remote, pens, pencils, hand sanitizers, and a tissue. We also design a patient's information board that can be attached to the site, allowing important information to remain visible without taking a valuable table space. But most important feature isn't any individual pocket, it's the position of entire system. Cat dog stays beside the patient, not across the room, not underneath the bed, not on the floor, right within the arm's reach. And to test our idea, we didn't need an expensive laboratory. We just started what we had: cardboards, woven straps, protective sleeves, and a lot of iteration. Our zero-budget prototype allowed us to test the arrangement, accessibility, stability, and usability before thinking about mass production. And the feedback gave us something important. The design made sense to users immediately. Patients could access their belongings with less twisting and reaching, and nurse could move around the bedside without having to work around another bulky cart. But a good idea isn't enough, especially in healthcare. A hospital product has to survive the real world. So, Cat Dog was designed with safety, hygiene, adaptability, and maintenance in mind. For the future production model, we proposed durable materials such as medical grade EVA, PU coated outer surface, PP structural boards, and antibacterial ABS components. The fabric components can be designed to detach for laundry. The structural components can be selected to withstand routine hospital disinfection, and because Cat Dog uses an adjustable attachment system, it can potentially serve different environments, from recovery wards and elderly care facilities to the other patient care settings. The modular approach also supports sustainability. If one pocket becomes damaged or worn out, we don't need to replace the entire organizer. We replace the part that connects directly to SDG 12, responsible consumption and production. And by supporting safer, more independent patient interaction with their environment, Cat Dog also contributes to SDG 3, good health and well-being. So let me return to this. A water bottle, a phone, or a tissue. None of these things are medically advanced. None of them require artificial intelligence, or none of them require a complicated machine. But when you are lying in a hospital bed, they can represent something much bigger. They represent independence, they represent dignity, they represent the feeling that I can still do something for myself. And that's what Cat Dog is really about. We didn't start it with technology, we started with empathy. We observed a human problem and we reframed it. We used design thinking to understand the people involved. We used trees to challenge the contradiction, and we transformed those insights into physical prototype. Because innovation doesn't always mean inventing something complicated. Sometimes it also means looking at something ordinary and asking, why does it have to be this way? Cat Dog exactly asks that question. Why should a patient have to struggle to reach a water bottle? Why should a nurse be interrupted for something that could be solved through a better design? Why should a bedside become more cluttered just because a patient needs more independence? We believe it shouldn't. Cat Dog brings essential things closer to the patient, closer to the independence, and closer to better care. Because sometimes involving healthcare doesn't begin with a breakthrough in medicine. Because sometimes it begins with simply putting the right thing within reach. And thank you.